I'm Dr. Freddy Caldera. I'm an assistant professor at University of Wisconsin School of Medicine and Public Health in the Department of Medicine and Division of Gastroenterology and Hepatology. I'm a gastroenterologist who specializes in treating patients with inflammatory bowel disease. And today I'd like to talk to you about our study of a clear liquid diet prior to bowel preparation predicts successful chromoendoscopy. First of all, I'd like to thank the gastrointestinal endoscopy editors for selecting our study as a manuscript for publication in this prestigious journal. So as this audience well knows, chromoendoscopy has been found to be associated with a higher dysplasia detection rate, not only in multiple studies, but meta-analysis. Publication of the scenic consensus statement has led to more chromoendoscopy cases being performed. And at University of Wisconsin, we decided to be performing chromoendoscopy for all patients undergoing surveillance exams with inflammatory bowel disease. One thing as a group we noticed was we were unable to perform chromoendoscopy in all cases. And because of this, we decided to perform a prospective study to evaluate what were predictors that affected our ability to perform chromoendoscopy. We hypothesized that most of these risk factors or predictors would be associated with the bowel preparation and the cleanliness of the colon. So we performed this prospective study between August 2015 and 2017. This study involved 3 endoscopists who were established performing chromoendoscopy, had been trained, and had at least performed 20 plus cases. From these endoscopists, patients were recruited prior to their colonoscopy. They were provided a questionnaire that the patient filled out that included questions regarding their preparation for their colonoscopy, evaluating the type of bowel preparation they used, how much of the bowel preparation they drank, their adherence to a clear liquid diet, and other pre-procedural variables. The questionnaire also included a section that the endoscopist filled out that included pre- and procedure variables, such as established risk factors for inadequate bowel preparation. We looked at history of constipation, history of diabetes. We also looked at procedural variables, such as the time of day, the time since split dosing, and other variables like that. During the procedure, endoscopists were asked to score the bowel preparations using the Boston Bowel Preparation Scale. They scored the cleanliness of the colon. All the endoscopists had been trained to use the Boston Bowel Preparation Scale. During our study period, 96 patients were recruited from these 3 endoscopists, but we only had final data for 88 of these patients. What we found was that we were only able to perform chromoendoscopy in half the cases, in only 50% of the cases. The leading reason for the inability to perform chromoendoscopy was, as we hypothesized, it was tied to bowel preparation. 57% of the cases, the endoscopist stated that he couldn't perform chromoendoscopy because of the cleanliness of the colon. The other main reason for inability to perform chromoendoscopy was due to colon inflammation in 29%. When we looked at univariate models, we found that traditional risk factors, such as history of constipation, diabetes, and other established risk factors for inadequate bowel prep, did not predict the ability to perform chromoendoscopy. The only variable in univariate analysis was adherence to a clear liquid diet for 24 hours prior to the procedure. When we analyzed this in a multivariate analysis, we found that traditional risk factors also didn't hold true. The only finding that we found that predicted the ability to perform chromoendoscopy was following a clear liquid diet for 24 hours. So our study was the first study to look at some of the ability to perform chromoendoscopy in patients undergoing a surveillance exam with inflammatory bowel disease. We feel that our study is important because as chromoendoscopy use increases, we need to have this ability to have a pristine colon. So if you perform chromoendoscopy in your practice, making sure that patient and patient instructions adhere to guidelines to follow a clear liquid diet is important. This will affect your ability to perform chromoendoscopy in your patient population and inherently affect your ability to identify dysplasia. Thank you very much for your time.